is Cynthia Johnson. I'm the chair of the program committee of our Phi Gamma chapter, chapter of Sigma Theta Tau International Nursing Society. We're happy today to present one of our series of programs this year. This particular program is entitled Barriers to International Service Learning Experiences. Our presenter is Julie Rhodes, MSN-RN, Weber State University nursing instructor, and Intermountain Healthcare Electronic Clinical Information Management. We're happy to have Julie presenting on this really current topic since we are an international chapter. Please view the circle for more of our programs. We do have a program coming up in February and March, and we'll be happy to answer any questions. Following this program, we will post a copy of this program PowerPoint on our circle, followed by some questions, and we would like an interactive dialogue and discussion on our circle. So you will be muted during the presentation, and we welcome you again to this presentation. Next, we will have Dr. Carol Lisk, our president, who will introduce Julie Rhodes. Dr. Lisk.
Thank you so much, Cynthia. I really appreciate that. Welcome, everybody, to our first program of 2015. It is absolutely my pleasure to introduce our presenter, Julie Rhodes. Julie is currently a nursing instructor for Weber State University in Ogden, Utah, the same university in which she received her associate degree in nursing 27 years ago. In the past 4 years, Julie advanced her education and attended Western Governors University, completing her BSN and her MSN in the education nursing specialty. I am proud to say that I was her course mentor for her final capstone course, assisting her research on the topic of international service learning experiences. Julie's professional experience includes roles in cardiovascular services, home care, hospice, exception-based documentation, clinical consistency in evidence-based practice, nursing informatics, and as a nursing instructor. She uses her nursing experience outside of employment as well, and has provided health-related community service internationally in developing countries in the form of orphanage support, shelters for street children, medical clinic and hospital assistance and development, and as a staff member of a hospital ship, and locally in the form of programs for children removed from their homes, and as a board member and chairperson for multiple nonprofit organizations. Julie loves nursing for the varied experiences available to her and to be able to share her talents, and for the wonderful people she meets. She is absolutely excited to be with us today to share the results of her MSN research project, which our chapter provided some funding, and will discuss her topic, Barriers to International Service Learning Experiences. With that, it is my pleasure to introduce Julie Rhodes.
Thank you, Carol. I appreciate it. Can you hear me? Okay, this is Julie Rhodes. Thank you. I appreciate the opportunity to be here and discuss barriers to international service learning experiences. As mentioned, I'm currently a nursing instructor. This is a new role for me, and I'm very excited about it. But I'd like to share the last little bit of my nursing education. Before we get started, I want to talk to you about why I chose this topic. Some of this has already been mentioned, but nursing has taken me in a lot of different areas over the years, both professionally and in a volunteer sense of things. I've been all over the world serving as a nurse in a volunteer capacity, and I have done some service here locally as well. I share this with you because this experience is what led me to seek this particular topic. Now, let's start with the definition of an international service learning experience. This definition comes directly from Jones, 2011, and has 3 parts. So, an international service learning experience is a structured experience, an academic experience in another country where students do 3 things. They participate in an activity that addresses the community needs. They learn from direct interaction and cross-cultural dialogue with others, and then they reflect on the experience. And during that reflection, we hope that they gain further understanding of the course content and a deeper understanding of global issues. Now that we understand what an international service learning experience is, let's talk a little bit about the background for this project and the overview. As I did my literature search, I was looking for things that would help me with this hypothesis. If barriers to international service learning experiences can be identified, maybe unintended consequences can be mitigated. There are many great articles on this topic out there in the research journals. A few that I relied heavily on are these that are listed here. John Carey from the US actually has a great article and an address on the globalization of higher education. When he talks about the globalization of higher education, from a nursing standpoint, we need to realize that a shift towards globalization of higher education also affects healthcare professionals. So as healthcare professionals, we want to improve global health conditions, and that is discussed in depth by Sheridan. There is also a study that talks about an increase in study abroad and international service learning experiences, and then another by Jones that talks about the benefits broken down by universities, studies, and host communities. That was written by Jones. And then lastly, there was a discussion about unintended consequences by Crabtree that related directly to barriers in international service learning experiences, and we will talk about a few of those. So let's talk about benefits and challenges of providing international service learning experiences. From the research, these are some of the items that I wanted to focus on. And this is part of the reason that I shared some of my experience with you. As was mentioned before, I've been an RN for almost 27 years. I never dreamed that my professional interests would lead me to some of these opportunities. And I never appreciated my nursing knowledge until I found myself in these positions. What I wanted to do was help people in the countries that I ended up in to be the best that they can be. And some of the things that I learned from these experiences are that they're great opportunities to serve and learn and share with others. I learned that outcomes can be positive if the community is part of the decision making. I learned for myself that unintended consequences can happen, and those consequences can be positive or negative. Let me just share a couple examples of those. I'll share the negative first so we can end on the positive. I was in a rural village in an African country setting up a medical clinic. We spent a couple of years setting up this medical clinic. And the intent of the medical clinic was not to give free medical care. It was to offer very low-cost medical care, very basic preventative care and very basic emergency care. The leaders of the village approved the ideas, approved the plans, were very excited. And we developed a way in which those that could not pay for their services were able to do a little bit of work on the site of the clinic so they could pay for those services. What happened is, as we started bringing money and supplies and different things into the medical clinic, the requirements that were outlined by the village kept raising so many times that we finally decided we'd invested enough money and enough time, and after 2 years the medical clinic was never opened, and the community went without this wonderful medical clinic that we wanted to provide. Was not the consequence that we expected to happen. It was a negative one in the fact that our being involved in the community showed the community leaders a couple of things. One, that we had money and we could buy things for them, and I believe that swayed some of their decisions away from the best decision for the community, and in the end they didn't end up with any of those services. So that's a negative example. That was completely an unintended consequence. Now let's look at a positive example of an unintended consequence. As was mentioned, I served aboard the USNS Mercy, a U.S. military hospital ship, and we served in a couple countries in the Asia Pacific. One of those countries was Vietnam, and I happened to be part of the first group of people that left the ship in a northern city in Vietnam where the U.S. military had not been back to since the war ended. There was a little bit of nervousness among all of us that attended that, only because we didn't know how the people would react. Luckily for me, my role was to be the discharge planner for the day. The rest of the team were surgeons and nurses and dentists and other medical personnel, and their job was to assess the patients, determine what surgical services they might need, if we could provide them on the ship, and then, if not, try to find some place to refer them to. So my role at the very end was to either explain to the patient that they were qualified for surgical, whatever the surgery was they needed, what that surgery entailed, when they were supposed to come, and all of those things. It also included the opportunity to explain why they would not be receiving services if they were not chosen for that day, and to help them find the services that they needed. So the first half hour or an hour I watched. I didn't have any patients yet, and I was able to watch as people filtered through this clinic. Now, I think the intended consequence of this venture was to provide much needed medical care. But what I saw when people started coming through, older men, faces were very grim, maybe just as nervous as we were. And as they started interacting with medical personnel, slowly huge smiles started forming on their faces. And their attitudes had completely changed, their demeanor completely changed by the time they got to my station. And I was left talking to very grateful people, grateful whether or not they received surgical services, grateful whether or not they were able to be referred out to another medical clinic. The unintended consequence of that example was peace in their own minds toward a nation that was at war with them a while ago. So a positive and a negative example of unintended consequences. And I've seen a lot of these over the years in my experiences, and I think it's something that we really need to focus on. Okay, moving on. Let's talk about what I found in my research. I went through about 45 different research articles dealing with international service learning experiences. And this is a list of all of the barriers that were identified. So broken into 3 columns here, we have a list of perceived barriers from the university outlook, a list from the student outlook, and those from the host community. Now granted, most of those didn't come directly from the host community. Those were things the host community told students or universities. But you can see we have cost on a couple of lists. We have duration on a couple of lists. Everything from ethics to how to engage the host community, research and evaluation. On the student side, there were a couple studies that talked about students being disillusioned after they experienced this new social awareness following their international service learning experience, and also some re-engagement issues. From the host community side, some of the issues were the ability of the host community to look at their true needs and identify those to whoever was coming to help in their community. Participating in the preparation and reciprocal sharing, those seem to be lacking, as well as sustainability. We hear that a lot these days. And then again, the unintended consequences that we looked at. So those are all the barriers that we began with. For this study, this is the strategy. For the research question was, what are the barriers to international service learning experiences? It had a follow-up question, what solution or strategies can be implemented to eliminate or mitigate these barriers? That was just a narrative that was not included in the numbers. The design of the survey was a quantitative survey. This design was used because the information collection was very basic. It was administered to a very well-defined single population, and the responses were easy to tally and analyze. The instrument that was utilized was a Likert scale for each population. The target was nursing faculty who have led international service learning experiences. Data collection was done through SurveyMonkey, and the data was stored anonymously in SurveyMonkey. And the data analysis, we used descriptive statistics using MODE specifically. So here are some of the results. I have 3 charts that we'll show you over the next few minutes. This one is specifically the barriers to international service learning experiences for universities. If you look at this chart, the blue bar, we're in agreement that this was a barrier. The red bars indicate those that disagreed that it was a barrier. So for the university, 7 of the original perceived barriers were outlined here. 5 of those were eliminated as barriers, and 2 of those were validated. So if you look, host community engagement, everyone agreed that that was a barrier. If you look at curriculum development, that is one of the ones that was eliminated. Agreed was a barrier. So same strategy on this next slide, looking at the barriers for students. So again, and duration was validated. Language was just almost validated, just barely at 50%. So 6 of the original perceived barriers, 3 of those were eliminated and 3 were validated. Then if we go on and look at the barriers to international service learning experiences for host communities, this was very interesting to me because all of the original perceived barriers were validated. So again, back to our table showing perceived barriers to international service learning experiences, you can see that we have eliminated quite a few. We've focused and validated those that are actually issues. So again, cost for both university and student, host community engagement from the university side, duration and language for students, and again, all 5 from the host community. So these are the recommendations that I've come up with for mitigating the barriers, and these are just the tip of the iceberg. I'm sure all of you can think of many more, but it's very obvious that the host community needs to be very involved in an international service learning experience from the very beginning of the planning stages. It's difficult for a host community to participate if they're not brought in from the very beginning. It's also difficult for them to do reciprocal sharing if they don't know what the intended project is about. So the first recommendation is to involve the host committee from the very beginning. The second recommendation is to look at cost and how to mitigate the cost. The suggestions that I came up with were to look at research grants that might be available, or look at sustainable projects that could continuously provide funding for whatever the international service learning experience is. Now, I'm not talking about funding necessarily from the student side of things, but maybe for the students and the host community. And then duration, is it possible that we could take students a few at a time instead of an entire group? So if you take my clinic village example, instead of having 10 or 15 students descend upon that clinic, could we have that clinic staffed with 1 or 2 students serving an international service learning experience, but have that stretched out so it's year-round? There are some difficulties in that, obviously, with school, but it would give more hands-on learning experience, and it would give the host community an opportunity to be more involved and do some of the reciprocal sharing that was missing. And then the last one for language, I think partnering with the local healthcare workers would help to provide translation, but then that would also be a huge benefit in the reciprocal sharing experience. So the challenge for this topic is that it was very narrow in focus. Finding a group to survey was very difficult, and I'm very grateful that your group graciously consented to help me. Finding a group of nursing faculty is difficult to begin with, and then finding a group of nursing faculty that have led international service learning experiences was almost impossible, but not impossible. As you'll notice, we did get some respondents. It was interesting. I'm grateful that Carol stuck with me. When I realized how narrow the focus was, I almost considered changing my project. But this is a passion of mine, and so I continued on and persisted in this area, and I'm excited with the study that we have come up with. If you look here at this graph, you'll see that we had over 120 participants. The very first question, however, weeded them out if they were not nursing educators leading an international service learning experience. So actual respondent number was low, and the ISLE leaders number was very low. But we did get some very good data and very good answers. These are the strengths and weaknesses of the project. And it was kind of an interesting, this is kind of an interesting answer. 33% of the barriers were validated for the university or entity. Again, 33% of them were validated for students or participants, and 100% were validated for the host community. Are these numbers a strength or a weakness? I haven't decided. They could be a strength because they identify areas that need work, and they could be a weakness because the statistics came from nursing educators and not necessarily the host community leaders. Recommendations for future research. I would like to see a study, and maybe I can do this myself, I don't know, but I would like to see a study that looks at all 3 of these groups individually. It would be very interesting to get the answers directly from the host community leaders that participate in international service learning experiences instead of just from the university faculty perspective. The same would be true of students participating in these kinds of experiences. I would also like to see a follow-up study if we were able to implement recommendations that are coming from the host community leaders. It would be interesting to go back and do the same study later about how effective the changes were based on the barriers that are identified by the host community. And then I'm also very interested in the actual unintended consequences, both good and bad. It would be interesting to gather exact examples and see if any of those unintended consequences lead directly back to these barriers. So I'd like to thank you for your time, and again, thank you for your participation in this study. It was very interesting, and I'm very excited to field your comments and questions.
Muted. Thank you so much, Julie, for this very, very interesting presentation. I have a few questions. For each service learning session, how many weeks or how long did you stay at any one place?
Myself personally, I have stayed anywhere from 10 days to 3 months.
Oh, okay.
It varied on the location and what our objective was for that location.
Yes, and each time was, for instance, if you want to compare 10 days, the length 10 days and 3 months, I know it depends on the project, but
Right.
do you see any differences?
Yes, for myself, the longer length of time gave me time to do a couple of things. From a nursing perspective, really to do a nursing assessment for myself of the community, really a public health type assessment, figure out how the community functioned, what was important in the community, and how our objective fit into the community. Any length of time that you can spend doing that type of an assessment will always improve the outcome of your project.
Yes.
And so the longer length of time is definitely my preference. I do understand that is difficult when you're a university student and don't have 3 months to take off for a service learning experience. But I think it's also better for the host community because they can get to know you and understand what you're trying to do as well.
Right, exactly. Now, how was the orientation or introduction, I must say, how was it done for the host community as far as how involved were they in the planning?
I think most of the areas where I participated as a participant, not as a leader, I didn't get to see how involved the host community was. I could tell, though, in my interaction with them, which ones were well prepared and those that had no idea what was going on. Those that were well prepared were very receptive, willing to help, willing to share, knew the program, knew what benefits it would offer their community, and knew how they could help us as participants to help their community. So I am a big proponent of that, and I don't think enough host communities get that opportunity. So myself, for areas where I've led some international medical expeditions to Ethiopia, just to help in medical clinics and actually do some teaching, just some education things. The ability to involve those host communities, it was easier for me because they had a long-standing relationship with me, and I had some of the same staff that assisted me from time to time, so they knew what we were coming to do and how to help, and they knew who the best person was to direct me to for what we were looking at.
Right.
Those went better than the experiences where we went in and just thought we were going to save the world by offering a little service. I know a little service goes a long way, but if you know, somebody used the example, if you bring flip-flops to a community that's dying of AIDS, did you really help?
Interesting. Dr. Johnson, this is Carol. May I ask a question?
Yes.
Julie, I'm always interested in the way we evolve as professionals. Can you explore a little bit or share with us how you see your role as an international nurse now, after you've completed your bachelor's and your master's, versus the way you approached this role 5, 6 years ago, if there is a change? And if so, how would you describe that evolution?
It's interesting you asked that question because two things, as I mentioned in my presentation, I don't think I appreciated my nursing education for what it was worth before I served internationally. As soon as I started serving internationally in any capacity, I realized the great wealth of knowledge that I had been given through my associate degree in nursing. That was a huge realization for me. Enough of a realization that after almost 10 years of serving internationally, I put all of that on hold because I wanted to return to my education for personal reasons. I did not choose to pursue my bachelor's and my master's for my career. I did it for my own personal knowledge and understanding because I felt like I was lacking a global perspective on healthcare. And so it's kind of interesting. I pursued a master's in nursing education because education seemed the most appropriate area to obtain that global perspective versus, a nursing master's in administration or nursing informatics or something like that. And along the line, really found that I enjoyed the education piece. So, kind of shockingly to my family, I ended up becoming a nursing instructor because of the courses I took in my master's for nursing education. That was not my intent in the beginning, but here I am finding myself as a brand new nursing instructor, thrilled to talk to nurses about global health and what I've learned from my experiences, and hoping that I can encourage them to gain a broader perspective. So I'm not sure where this is all going to take me, but I can assure you that it's not finished. I have a burning passion and desire.
Oh, that's fantastic. That is fantastic. Thank you.
You're welcome.
So Julie, go ahead, Benson.
Oh, yeah, I was just going to say, it's very interesting and actually very appropriate that you're doing this presentation today, because, I really didn't realize this until Facebook told me earlier, but today would have been the birthday for Albert Schweitzer. And I don't know if you're familiar with who he is. He was a humanitarian and a philosopher and a physician who he was a Nobel Prize winner in the 50s, wrote a book. But there's a service learning fellowship created in his name called the Schweitzer Fellowship. And I was encouraged by one of my mentors through Sigma Theta Tau from Rush in Chicago to apply. And it was really one of the most enjoyable experiences of my master's program. And I think, some of the things that you found in your personal experiences really resonate with some of the tenets that they talk about with the Schweitzer Fellowship, and just kind of in my experience too. But it's that whole idea of sustainability and really coming in and understanding the community that that understanding the work that you're trying to do. And I really think that's where you see the real beauty of the nursing process, when you come into a place and really do a good needs assessment and work with that community to figure out what are the things that they're capable of doing. And your intent is not to come in and slap a Band-Aid on, but really to come in and create something that's sustainable. And
Yes.
I just kind of felt that connection was very apropos for today, and so I just wanted to kind of share.
Thank you, Vincent.
Thank you for sharing that. I was unaware that that was today. I appreciate that.
That is an excellent point. And I would like to also share with you, Julie, that I think it was serendipitous that you linked into our chapter, the international chapter. How appropriate not only for the target participant, but also to share this wonderful knowledge. And I hope that your relationship with our chapter blossoms and grows, because it will only feed and fuel your passion, but you bring so much to the table in terms of that crucial understanding of global health. And that is what Sigma is all about and what it has grown into, particularly over in the last 5 to 10 years. So thank you so much for giving us this opportunity to share your knowledge with us. I've really appreciated it as a former professor and also as a colleague. Thank you.
Thank you.
I do too. I do too. You have that lived experience in global health, that experience that people will die for. It's just really nice. And thank you for coming to our chapter. I have a question about the cost. And you mentioned in your recommendations, I think, that research grants can help from the university.
Mm-hmm.
And I find in my knowledge on global health and my experience, if you involve the president of the university and get a memorandum of understanding, things go much smoother as far as the finance and the agreement. For instance, the project we're doing in Tanzania, the cost sharing, when we go there, they provide the meals and the hotels. And we provide the information and the airfare. Our university does that through grants, and we individually apply for grants, and the dean, and we get everyone involved so that no one person bear the brunt of the cost. And we know it gets very costly.
Wonderful.
Mhm.
I think that's great. And I think we need to look for innovative ideas like that. I also think the community that you're going to serve should bear some responsibility in some way.
Yes.
And I realize that some of them have very little in the form of temporal resources, but my experience has been that most of them have a desire to do something. And if you can find that desire and let them help, that will make it go a long way.
Yes.
Julie, do you also find that it's also that concept of vested interest, and not unlike Weight Watchers, where they say that a nominal amount buys somebody into it? Do you think that investing, whether it's time, talent, or treasure, that the community, the host community, gleans more from the experience as well?
Definitely. I've had some personal experience with that. One of the rural hospitals that I spent time working in, and this was in Ethiopia, a lot of patients would come in, and because Western medicine is not new but not common in Ethiopia, if, let's say, a bacterial infection were identified and antibiotics were given, typically that patient, they were not oftentimes compliant with the medication regimen. And there are a couple things that contributed to that. One of the things is they didn't necessarily understand Western medicine. That was one. Number two, culturally it was a little bit different from what they were used to receiving. But number three, they were given that medication for free. And one of the conversations I had with the director of that hospital was, can you charge people just a little bit for those medications? Not because you need to pay for them. What you will get from them won't be anywhere near the cost of those medications. But what you will get from them is their commitment to take that medication. If they're going to pay a little bit, they will probably follow the medication regimen. So yes.
That is really true. I guess the concept of Habitat for Humanity, where you assist in building the homes, gives you,
Yes.
a greater greater responsibility or commitment or whatever. And that's on the same concept, I think.
Definitely gives you that vested interest. One of the plans we had outlined for our clinic that we didn't end up opening was that concept of charging what would a dime for each prescription, knowing that it would be difficult for some of the families to come up with that dime, but giving them the opportunity to harvest sisal. In Ethiopia, they peel the fibers out of a plant called sisal to make rope and bags and different things. It's not hard to transport sisal to the site of the clinic, and while they're waiting, have them peel the fibers out of the plant, but using that as a mechanism to give them an opportunity to pay if they could not pay. And the other part of that was of the family provide that service, because in Ethiopia the fathers plant during the summer season, and during the rest of the time the women and the children do the work, and the fathers were sitting around with not much to do. So there were a few different things we were looking at, to make them feel the need to be compliant with the treatment that they received.
Julie, does that also, when you ask them to buy in some way, enhance, it would seem to me that would also enhance the dignity of the experience as well.
Go ahead.
No, I was just going to say, from the standpoint of, exactly that they are providing something for the service, and it isn't just being given to them.
Definitely. I don't think any of us want someone to come in our community and try to rescue us necessarily, because that is hard on all of us. And, so if you give people the opportunity to contribute, to make those decisions, that definitely gives them back their dignity. And it also gives us the opportunity to learn from them. I think we can learn just as much, if not more. I always seem to learn more from them than I think that I'm giving.
Yes.
Mm-hmm.
Now, going back to the experience on the medical clinic.
Yes.
I think I missed, maybe give me 2 reasons you think that the clinic never opened, just 2.
I think the first reason is the elders of the community saw an opportunity to make some money. And I hate to, that's kind of an ugly truth to bring to light. I think they saw some Americans that had some money, and we did comply with some higher demands. So based off of our initial contract, they asked for more things, not medical things. Well, if you're going to build a medical clinic, why don't you, add on to our community center? Well, that's great. That's a help for the community, but that took away money from the medical clinic. But every time we completed something like that, another request came, and we were not granted the license that we thought we were obtaining. And so finally, after 3 or 4 times of trying to meet some kind of a monetary demand, we finally decided enough was enough. We had an original agreement that we kept to, and they kept changing.
So all in all, I really enjoyed this presentation.
Well, thank you.
Yes.
Good questions.
Yeah. Any more questions? Benson, Carol?
No, I don't. Other than, again, thank you so much, Julie.
You're very welcome. Thanks for having me.
And Julie, I'm wondering if we can have a reference list, because I would love to read the articles that you presented on.
Yes, definitely.
Yes, that would be helpful. They look like very good articles.
They're very good articles, and there are many more out there. So
Yes.
I will pull together my official reference list, and then I have a whole unofficial reference list.
Any questions from you, Benson?
No, and Julie, I think too that I think like any good project, this is really, you know, giving you some opportunity for further look at you know, topics too. And I think maybe, you know, getting the student side of these same questions, or the community side too, might lead to some really interesting insights. So
Yes.
nice work. And congratulations on the master's and the new job too.
Thank you.
Yes, congratulations and thank you.
You're welcome.
Okay, as we end this webinar, I would like for you to tune into the circle, where there will be more questions and discussions, and please let us have an interactive discussion on this very, very important topic and very current topic. I thank everyone for attending the webinar, and we'll see you at our next webinar later this year. Goodbye.